Welcome back to Did You Know, a podcast by Partner Veterinary. In this series, we explore all things veterinary medicine and all things partner. In each episode, we answer some of the most common questions we are asked, from HR to emergencies and everything in between. If it happens at Partner, we'll cover it. As pet owners, we've all been there. It's late at night, your dog is acting strange, or your cat won't eat, and you're frantically wondering, is this an emergency? Should I rush to the vet right now? Or can this wait until morning? Today, we're diving deep into one of the most stressful situations pet owners face, determining what constitutes a true pet emergency. Joining us is Dr. Miriah Wilson, the lead emergency veterinarian at our Frederick Hospital. She sees these critical decisions play out every single day. Dr. Wilson will walk us through the top 5 emergencies that absolutely cannot wait. She'll help you organize the warning signs that demand immediate action, and perhaps just as importantly, discuss those common situations that feel scary but can actually wait for your regular vet. We'll also explore how emergency triage works, so you'll know exactly what to expect if you ever find yourself rushing through our clinic doors with a sick pet. Whether you're a new pet parent or a seasoned owner, this episode could literally be a lifesaver for your furry family member. Let's get started.
My name's Miriah Wilson. I'm the lead ER veterinarian at Partner. This typically involves overseeing the doctor team workflow within the ER and helping to grow this collaborative and cohesive environment between our ER team members and the rest of the hospital.
Dr. Wilson, can you tell us how you got started in vet medicine and why you chose to work in emergency veterinary medicine?
Sure. I became passionate about animals at a pretty young age, and I pretty much chose to pursue this career path early in life, as you'll hear from a lot of vets. I started working as a kennel assistant and worked my way through the ranks, became a vet out of the University of Illinois. And it was pretty early on in my career when I became a vet assistant that I realized my love of ER medicine, and that really stuck with me through vet school. So I went in right into ER medicine right after vet school and have stayed here ever since.
What brought you to Partner?
Partner is very much everything that I've wanted from a vet clinic and an ER practice put together. It's the support of having the support of the management team, as well as having the freedom to see the cases that I want to see and do medicine how I want to do medicine, to the highest standards. So they really set the bar high, and they've been coming through with that for sure.
Today, we're going to talk about emergencies and what can and cannot wait. Can you give us what the top 5 emergencies are that cannot wait?
Yeah, so I'm sure this list is way more extensive than what we are going to pare it down to. And there's a lot of arguments that could say one thing could be more emergent than another. But the top 5 that come to mind would be anything with any sort of labored breathing or respiratory distress, most traumatic incidences. So, your typical hit by cars, animal that's kicked in the head by a larger animal, just those bigger traumatic incidences, any type of heat stroke, which is more so seen in dogs, any sort of collapse / loss of consciousness episode, typically require they get right into us. And then another big one, typically mainly seen in dogs, is GDV, or most people know it as bloat. So I would kind of say those are probably top 5 that I would say need to come in immediately.
From those top 5, can you walk us through what some of the causes, signs, and symptoms, and then the treatment of each, and explain what owners should look for when we're talking about these specific emergencies?
Sure. We can start with your typical respiratory distress. A lot of times you can see the heavy breathing, labored breathing, with many different conditions. So it could range from a sort of like lung infection like pneumonia to heart failure, low red blood cell counts, or better known as anemia. You could even have fluid that sits outside of the lungs that causes the lungs not to be able to expand. There are some other metabolic issues that can cause a higher respiratory rate as well. And those are just a little bit more tricky to figure out because you have to do a little bit extra testing. So as you can imagine, you'll see a higher respiratory rate. You'll see an abnormal pattern of respiration. So really short, quick breaths, or a really hard expiration, or just really hard like work of breathing in general. The treatment, all of these, it's going to be oxygen therapy, which requires hospitalization. But, it depends on what we discover further that dictates how we treat otherwise. So heart medications or antibiotics, things like that. Next, if we want to talk about like collapse and loss of consciousness, there are a lot of different things that can cause this. So it's difficult to get into the treatment of it. And the signs and symptoms, it's pretty much what you see. You're going to see the total falling over. And when you call their name, they're not responding to you. And it could start with a little bit of stumbling, and they can't keep their balance, or they just appear really weak. And then all of a sudden your animal just does not seem there whatsoever. So, this can be caused by severe blood loss internally that maybe you can't see with the eye. It could be, really bad issues with blood pressure, and that may cause stroke-like type of events. Low blood sugar, severe dehydration, even certain like intermittent arrhythmias can cause things like that. So most of the time, these kind of cases, sometimes they actually come out of it by the time they get to us in hospital, but we typically still will recommend that we check a blood pressure. We'll check some blood work. We'll check an ECG, and then kind of go from there whether we need to do further advanced testing, or is it kind of a wait and see approach and see if, it happens again.
With collapse, I'm just going to interrupt you real quick. Is that sometimes with seizures as well? And is that something different when a dog or a cat has a seizure that people are looking for?
Yeah, so seizures, a lot of times you'll see them come back out of it. When an animal has a seizure, it doesn't necessarily mean that someone has to rush right in. Seizures, they definitely, you can see them collapse on their side and have abnormal movements of the body, and they do typically experience a loss of consciousness with your larger seizures. So they are definitely an abnormality in your animal's condition. However, one seizure doesn't necessarily say, hey, you got to get into the ER immediately, because it could just be that they have one seizure only once every 6 months and you never see it again. It does warrant a follow-up with your primary vet typically, but if it's one seizure, you don't have to rush them in. Now, if they have more than 2 or 3 in 24 hours, we definitely want to see you.
Okay, got that.
Yeah. I think next we can talk about GDV or bloat, better known as, gastric dilatation volvulus. Most people know it as bloat. This is typically going to occur in your large breed, really deep-chested dogs, so your German Shepherds, Great Danes, animals like that. We are unsure of the true cause of this, but it typically occurs when the stomach expands with gas and then the stomach actually flips on itself. That sometimes they can actually bring other organs in, such as the spleen, and the spleen can get wrapped up. And then what happens is that everything is very stretched and then twisted, so you're compromising blood flow to those areas. So these animals sometimes have like sections of their stomach that need to be fully removed, or they can't use their spleen anymore because of how damaged it has become. So it typically, it's quite emergent. It can cause really severe blood pressure changes. It can cause abnormal heart rhythms. You usually will see this really large distended stomach, heavy panting and discomfort in general, even sometimes some really bad weakness. And if it goes on for too long, your pet absolutely can die at home. So we have to see them within hours, and it does not take them long, unfortunately, to succumb to something like this. So typical treatment is getting them into us. We start to stabilize immediately, which typically involves pain medications, IV fluids, and then trocherization, which is we actually use a needle from the side of the body wall, and we introduce it into the stomach to relieve a lot of that gas, to hopefully better allow blood flow and perfusion to those abdominal organs that aren't getting it. It at least buys us a little bit of time to get the animal into surgery. And then next, we can talk about heat stroke, which again, we see more so in dogs than cats. I guess it can happen in cats, but cats are typically more on that lazy side, and they're going to hide in shaded areas when it's sunny. They're not really running around chasing a ball and that kind of stuff. So, but heat stroke, you're probably going to know when it's likely heat stroke because you had an animal outside and heavy exercise, running around, or a lot of our brachycephalic or those smushy faced breeds can succumb to heat stroke quite quickly because as they're panting, they're unable to regulate their temperature as easily as some of the other dog breeds. So you will likely see that heavy panting. You'll see weakness. You'll a lot of times see more of an altered mentation where they're just not quite right. If you have the ability to check their temperature at home, you absolutely can. A lot of times you're going to see that it's over 105, 106, and sometimes it's unreadable on a thermometer. And many times you'll also see vomiting and diarrhea coupled with these cases because dogs, their shock organ is actually their GI tract. So as soon as their body goes into any type of shock, you're going to start seeing vomiting, diarrhea, maybe just really bad drooling, signs of nausea. This typical treatment involves slowly lowering their temperature, obviously. We want to get aggressive IV fluid therapy on board, supporting their GI tract, so that vomiting and diarrhea. And then we monitor their mentation, their vitals, as that temperature starts to lower and get back to normal. Sometimes these dogs can actually develop a really bad clotting issue or a coagulopathy because of the shock to their system. So those are things that we monitor, and sometimes these guys actually need fresh frozen plasma transfusions, and a lot of these guys actually need multiple days in hospital. So they can be extremely, extremely critical. And then I guess the last one is kind of a little bit more broad again, but trauma. So again, any animal that's hit by a vehicle, it may include some of those times where a small animal falls off of a balcony or is dropped from a high stairwell or something like that. Or even, unfortunately, we do see this where we get animals that come in abuse situations that have been hit, or something like that. And, obviously we don't want to talk about it, but we do see it. Yeah. The biggest things that we're assessing for are things like traumatic brain injury, external bleeding, internal bleeding. So we can perform a quick scan of the chest and the abdomen with an ultrasound probe as an ER doctor, where we're looking for fluid and what is that fluid? And, is it blood? Is it something we need to go to emergency surgery with? Or is it something we're just going to quick monitor? This also might involve, your orthopedic traumatic fractures and things like that. So typically they're going to come in, we're going to do a quick physical exam and go from there, usually IV catheter and fluids, because typically these animals are in some sort of shocky sort of state. Mm-hmm. And then pain meds are usually next on the list. And then, maybe a quick blood panel and some x-rays and go from there. So those are kind of the bigger ones that we see most frequently, as far as like what needs to be seen before all the others.
So those are the ones, some of them that need to be seen right away and that can't wait. What are others that can wait? I'm sure there's plenty on the list, but some of the things that perhaps people would think, oh gosh, I've got to get them in right away, but they actually can wait. Can you give us a rundown of those?
Yeah. And again, all of these kind of, there's always the exception to the rule. So, I'd like to say if your animal starts limping or has been limping for 2 days, that's probably something that your primary vet can see. But there's also those cases where they're limping and it turns out that they do have a fracture and it should be seen. And, there's not a way that we can say what it typically is without seeing them. So again, everything comes with an exception to the rule. Another one that could potentially wait is coughing, unless you're seeing that coupled with something like respiratory distress, as we talked about earlier. Simple, couple episodes of coughing in a day, or even if it is productive, a lot of diseases are self-limiting, or a lot of them are more chronic, and you should still get in with your primary vet to see why it's happening. I also would like to include like a single episode of vomiting or diarrhea into this list. One episode of vomiting, it could just be we had an upset tummy. In this case, I usually recommend let's hold food and water for 6 to 8 hours or so, unless they're super young, and then start offering more of a bland diet. So typically in situations with dogs, we're recommending chicken and rice, no spices, no oil, no butter, no seasonings. And in cats, sometimes that might include more of like canned tuna in water. There's a lot of cats that won't actually eat a bland diet, so we just say hold food and water for 6 to 8 hours and start offering a very small amount of their normal food. If you see diarrhea, same sort of thing. You want to allow their stomach some time to settle, and then you want to start with that bland diet. Again, there's that exception to the rule. You're seeing vomiting, and then you start seeing heavy breathing after that. You should probably bring them in. You see diarrhea, and then the diarrhea becomes more frequent and it becomes progressively really bloody. We want to see them. We want to help them. We don't want them to get too dehydrated too quick. So one episode is one thing, but as things progress, we really have to think like, okay, what are our next steps? Should I start calling partner now and see if I need to bring my animal in? And then another one that, can typically wait is things like if you're seeing that your animal's sneezing, but they're having clear nasal discharge. It could just be something minor and viral. But as soon as that like clear nasal or ocular discharge may turn like mucoid and yellow or green, those are times probably should get seen. Again, you might still be able to wait a little bit and get in with your primary vet, as long as there's no respiratory distress with it, as long as they're still eating, and as long as they're still kind of going about their day normally. So those are kind of some more common ones that end up being, if they come in and the owners and the pets want to be seen, then they may wait a little bit longer in comparison to those other emergencies we discussed.
Right. And that's something I think we try to share with our clients is that, there sometimes is a longer wait because sometimes there are very critical cases that come into the hospital.
Yeah, we do a triage scoring system, which is more for an internal use, but we do try to educate our clients on where their animal may be on that scoring system, and say that, and it's usually a system 1 through 5, say that we put your animal at a 4 or a 5. You're definitely going to have a longer wait than say that 1 or number 2 that came in. And if we've got a whole slew of number 1s, number 2s, and number 3s, you might wait all night. Or we might say, hey, maybe this is something that these are some at-home remedies you could try. So if you're there for that single episode of vomiting, maybe we say, hey, you're looking at potentially an 8-hour wait with everything that's going on, and we have no idea what's still going to come through the door. You always could try this and head back our way, because with these triages, we are taking vitals and we're at least getting a little bit of a history. Our techs are getting a bit of a history from an owner. So there are certain triggers that we say, oh, it definitely needs to be seen a little bit sooner than another one. So
that's really helpful. What would you say is the best takeaway from this discussion for clients?
I would say the biggest thing is if your animal's having trouble breathing, get it in to see us. I think that's one of the biggest signs of acute emergent illness. But the other thing is, if you're concerned, give us a call. We don't mind getting calls. We want to help. And, there's times where we may say we're not really sure. We'd like you to have your pet at least evaluated and then go from there, whether we, see where we put your animal in the triage scoring system, because sometimes it is difficult to evaluate what you're seeing and what might be emergent or not. So
this was really helpful. Thank you so much for taking the time to chat with us, Dr. Wilson.
absolutely. Until next time.
Thank you for listening to Did You Know? Is there something about Partner that you want to know? Email us at letstalk@partnervesc.com. Who knows, we might turn your question into an entire episode. You can now find us wherever you listen to all of your other favorite podcasts. Subscribe now.